Hello, everyone. This particular small session will be for how to face the interview when you're going for your Army Dental Corps, right? Now, most of us have not faced an interview, so we don't know, like how is it to face an interview? And over here, we find that it's not one person, like how we used to have in a college during our exam viva. We had one internal and one external, right? Sometimes the other department staff just come and sit all around you, and then we start panicking. Now, here you may have anywhere between 6 to 9 members who will be there on the interview board to ask you questions. So it all depends. Sometimes you may even have as less as 4 members. Sometimes you may have almost as high as 9 members, right? So how do we face this interview? Because this is the most important thing. Okay. Now, my dear students, a simple word of advice before you really go for the interview is this: do I really want to join the army? Why am I joining the army? This, I think you should answer it before you yourself go. Just because you have received a call letter, okay, you got a good rank in NEET, and you thought, okay, maybe easy way to settle down fast. It is not the only thing. Are you ready for the life of discipline? Are you ready for the life of, service to the country? Are you really passionate about being in the army? There's a few things which I think you should answer honestly and faithfully to yourself before you really take this jump about going ahead and giving this interview to get selected into the army. Okay, so this few things which you should really be able to answer to yourself: do I really love to be in the army? Can I be in the army for the next 14 years or so? You have short service commission for 5 years, and then you can extend it again. Or if you're going for a permanent commission, am I ready for this life for throughout my life, until I'm 50, 58, or whatever? Am I ready for it? There's a few things which you should answer before you really go for this interview. Because please note that when you're going for the interview, they are not there to really check your subject knowledge, because you guys have topped the NEET exam, right? More than 25,000 students write the exam, and you're already there in the top. You're already there in the top 2,000. Top 2,000 or top 2,500 ranking. That means there is some stuff inside you. Otherwise, you would not have got that NEET rank, isn't it? And that is then they call you for the interview. So, what is more important to understand here is that their knowledge about the subject is not as important as how you look. Your level of confidence, your level of answering the questions in the interview is what is more important than the subject per se. Okay, so first of all, ask yourself, do I really want to be in the army? Because I think it is reflected in the body language when you go there and you sit there in the interview board. Okay, right. The next thing which I think you should really know, my dear students, is the minute you pass the interview, you have your medicals and all that, and if you get through all that, you're becoming a captain, right? So when you're becoming a captain, it is a post of honor, and it's a post wherein you serve people under you. I mean, I'm sorry, you serve people above you, and there are people under you, right? So they check for certain qualities. Does this person have the leadership quality? Is he worthy to be a captain in the Indian Army, which is such a respectable body, right? Does he have that? Does he have that plus factor? Does he have that X factor within him so that he can really lead his people under him? These are few things which they will really assess you on that day, right? And from this year, you all know that, for example, for this year, the vacancy there are only 30 seats, and the ratio is 1:9. So for every 9 boys, one girl gets in. So it is 27 boys and 3 girls. That's all that the total number of students we're going to get through this time. And of course, the vacancy changes every year. So yeah. So that's how it is. Okay, right. So let's begin the process of interview. Again, my dear students, I'm telling you again, your subject knowledge is not important, but how you look, how you face them, how you go to answer the questions in the interview is what is more important. Okay, let's take it up. Now, first and foremost, a few important things like how you dress yourself, right? Your haircut, for example, how you really tie your hair up for the ladies, for the smart gentlemen who are going to give the interview, how you really dress. When I say dress, shoes, polished. You're wearing a formal shirt, a formal pant, you're having a belt over there. Is it very well pressed? pressed to the crease? How's your haircut? How are your nails? Are they well trimmed? Have you really taken care of yourself? No stubbles, have you really taken a clean shave? You can go with an army haircut. Absolutely nothing wrong. You go the well prepared as though you've got into the army. Okay. So it's very, very important. So how you enter the room, walk with confidence. Take the permission of the people, sir, may I sit down, right? And then you can sit down and wish them, good morning, sir, good morning, ma'am, or however it is, good morning, sirs, good morning, ma'ams, depending on the number of people, right? So the way you respect, the way you give, that respect to your seniors is, I think, very, very important. And, Indian Army, not the Army, in Army, Air Force, your Navy, the hierarchy system is very, very important. So how you respond to their inquiries, how you respond to the queries, I think is very, very, very important, right? And say it should come from your heart when you're answering, and it can be cleanly visible on your face when you're really doing the answering. Okay, so yes. So again, my dear students, see, when you're answering a question, confidence is very important, okay, but not overconfidence. Overconfidence kills. Underconfidence kills. But confidence. Suppose somebody is asking you a question, right? So you look into their eyes and answer, right? If you don't know the answer, respectfully, I'm sorry, ma'am, I'm not sure about the answer. That is how you should be. And not go on telling some rubbish, which you think is the answer. If you don't know, tell you don't know. Again, they are not assessing your subject knowledge. My dear and dear students, you have already topped the NEET exam and you've got through. There is stuff inside you, okay? How you behave, how you talk, how you tackle the questions is what is more important, okay? Right? So confident. Again, do not answer with servility. Servility is like a servant, but answer with humility. With humility, in the sense, every answer should end with sir, should end with ma'am, not too much. Over bhi nahi karna chahiye. Bowing down, bending down when you're answering like this. No. Your posture. Sit properly. Sit. Not like that, but sit with that grace. Very important word to be used, my dear students, is grace. I think the students from an army background will already have all this inside them, because they have been seeing their parents, probably their father who's in the army, or probably the mother who's in the army, and students from they go for these parties and all that. So there is that, you will know that, right? Most of us who are not from an army background should have a little bit of practice before you really go for the interview. Okay, right. The next thing is the interview process per se, right? So now there could be one psychologist who's probably just observing you, who's observing how you're sitting, right? Are you, hyperhidrosis? Are you moving your hands like that? Are you moving your shirt and you're trying to tuck in every time because you're getting too conscious? Restless leg syndrome. Are you moving your legs very often? Or are you not looking into them? You're looking at the ceiling all the time. You're looking down. You're looking underconfident like that. Stooping down. There's a few things which those persons. It's very, very important. That scoring is very important. What he or she gives you. A person who's observing you. Right. So how you respond to their answers, how you sit, how you elegantly, with poise, answer the questions is what is extremely important, my dear and dear students. Okay, even if you don't know the answer, it is okay. You don't have to worry. There can be 100 people there. Why should you bother? Right? You don't have to worry. Right? My dear students, we're already in Cedees. See, when I talk, I know that I'm talking to 3,000, 4,000 students. I don't care. There are 10,000 students. I don't care. Right? Once I was taking a medical interview. I was doing anatomy for head and neck for the medical students, and there were almost like 700, 800 students attending the lecture. Now, if you're worried about it, oh my God, there are so many students watching your every move, you will never be confident, right? So ignore about everything. You sit there, you have, there could be 9 people there, 10 people, don't worry. They are there to assess you. So you sit elegantly. Whatever you know, you answered in a very polite manner, with a lot of respect, with a lot of humility, and I think your job is done. Okay, right. Now about the interview process per se, that what they can ask you. Questions can come in 5 different categories, right? questions, I'll just write down. Questions can be from a medical background. They can be from a dental background. They can be from a general background. Okay. Or they could be from a personal background. And they could be from an army background. These are 5 areas in which, and I'll put something in the box called as a leadership skill. Okay. These are the few areas where you are assessed. Let's start one by one, right? Now, if you're going from a medical background, what is it that they will assess from a medical background? Your medical knowledge. I still remember one of my students was asked, a patient has come to you and you're doubtful if he has hypertension. How do you record BP? Now, this guy only studied MCQs. He knew what is Korotkov sound and all that, but he didn't know the exact process of measuring a BP. He didn't know. He's a doctor, right? Then they can ask you about diabetes, about the laboratory tests for diabetes which can be done, and very general stuff. They can ask you about pharmacology, they can ask you about NSAIDs, they can ask you about antihypertensives, antidiabetics, the simple antibiotics that we're using, penicillins. I still remember when one of my students who got selected, who was an army captain now, he was asked about penicillins. He was asked about the mechanism of action. He was asked about the resistance to that, the new classification that is there, a whole lot of stuff from the pharmacological point of view. One more student who got selected. Yeah, I still remember. He was quite short, but he still got selected. He had attended a lecture in Cedees when I was covering on anticoagulants, and I still remember. So he was asked a question about a person who had an MI. A myocardial infarction. Then he started giving drugs. You must know there's a password called Mona for that. That's morphine and things like that. So he said, anticoagulants. And he said, okay, you tell me how the warfarin acts. And he jumped and he said, yes, warfarin, sir, it blocks vitamin K, epoxide reductase enzyme. Heparin basically combines with antithrombin 3 and the mechanism of action is seen. And, they were so impressed. They were like, wow, good. So, I mean, that's again your luck. It depends on from where the questions are coming from. It's not a structured format, okay? So, it's different. So, basically, this is what does medical mean. General medicine and general surgery. General surgery, they can ask you on burns, they can ask you on shock, they can ask you on wound healing. These are a few areas which I think have been the stress areas for quite some time, all right? And they might ask you some bouncer questions in medicine, but it makes no difference. They might probably know that this guy will not know it, okay, right? But how you tackle them until, I'm sorry, sir, I have no idea about this question, or I'm sorry, sir, I don't know the answer for this question. That's all. Then they'll move on to the next thing. So please don't worry. Okay. So when it comes to medical, the most general stuff, pharmacology of the most commonly used drugs, simple ailments, what is hypertension, BP, a little bit on MI, the cardiovascular problems, most commonly found, a little bit on asthma, a little bit on, that's all, a little very brief to know what is it, and if you should be able to answer them. It's as simple as that, okay? Suppose you're traveling on a hilly area, what drugs can be given to avoid vomiting sickness or morning sickness, things like that, so you should be able to give them some answer. Hormonal influences are very important. I still remember some of the students were asked about this. So please make sure that you can grab it. Next comes dental. Now, dental, your clinical subjects are super duper important, okay? Like subjects like prosto, your conservative, oral surgery. Oh my God, oral surgery. You should know about impactions. You should know about the classification, what they've asked there. I still remember some of my students were asked, general question like this. Suppose in your OT, a patient comes to you who has a space infection. How do you manage it? It's a simple question. So then, about space infection, how do you diagnose which kind of space infection? Primary, secondary. Is the patient under a respiratory embarrassment? Should he be treated immediately? How do you do the treatment? What is cricothyrotomy or what is tracheostomy, or do you put a drain, or what do you do? The things like that. So space infections, I think, are very important. Prosthodontics and conservative, I think, conservative, the material aspect, whether it is amalgams, whether it is composite, cast restorations, I think you should be quite clear. Oral pathology, they can ask you a lot on cysts and tumors. For example, I guess today they were asking about how an amyloblastoma looks like. It can also be from an oral surgery point of view also, right? Cysts and tumors can also come there. So I think your basic concepts of these subjects. And of course, you have ortho or pedo as the case may be. So basically, all your clinical subjects. So one of the fastest way to do is probably do the synopsis of almost all the clinical subjects. And if you're a Cedees student, you can go through the Cedees notes, lectures that have been taken by me. I'm sorry, by your sir, and whatever notes which you are prepared, I think you can just brush through, and I think it should be all right. Okay, so please don't worry, because medical and dental are two areas where they know that you have already studied and you've gone through. But so the and they will. I don't. They already know that you're a good student, but you cannot afford to make a blunder in simple things like if they're asking you a little bit on extraction, or if they're asking you, something like that, and if you don't answer, it's going to be really sad. Okay, like for example, which forceps are used, or why do you give the apical pressure first before extracting a tooth? So things like that, very basic, they can ask you, and if you don't know, then right. For amalgam disposal, I believe it was asked today. So things like that. So some concepts you should be very, very clear. Okay, right. So medical dental. Next comes the general. When I say general, it's general knowledge and current affairs. Current affairs. Okay. For example, you're going there now. See, you're becoming an army captain, so you should know everything that's happening around you, isn't it? So they can ask you about the Russia-Ukraine war that is going on, right? Or probably they can ask you about Sri Lanka, what is happening. They went into an economic meltdown. What basically happened in Sri Lanka, right? Or they can probably ask you about the US. What's happening in the US, what's happening to the US presidency. Or they can ask you something about Brexit. They just want to know if you have some idea about the current affairs. So that concept should be very clear. Again, in general, you should know everything about COVID, right? You should know about everything about the vaccines which have been used, where India is right now in COVID, what are the various websites for COVID, Serum Institute of India, a whole lot of concepts like that. On COVID, you should be very, 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 very thorough, especially the different vaccines which are available. I think you should be very clear, right? And again, in general, for example, sterilization and disinfection, I think is very, very important, especially now in the COVID era, right? So how do you, how do you wear the PPE properly? What are the various steps? How do you dispose of gloves? How do you dispose of a patient? Things, how do you sterilize a particular area? Spalding's classification, which is there in microbiology. So these are few things which I think you should be aware. How do you sterilize your OT? How do you sterilize your clinic? How do you disinfect? I'm sorry. So these are few things which I think your concept should be very, very clear, especially after the COVID scenario. So like that. Current affairs, you should know. Okay, if you have somebody in your family who's a good reader about newspaper every day, obviously it's not there in your pulse, not there in your institute papers, isn't it, right? So you should get this knowledge, and it's very, very, very important, right? So sometimes I think they're much more important than your medical and dental information. So your concept about the general knowledge, what's happening in and around the country. I still remember somebody, they asked who is the home minister, and the person didn't know. So you cannot afford to make a mistake like that, right? Who is the home minister? Who is the defense minister? Who is the present finance minister? What do you think about? Probably they might ask you, what do you think about GST, or what do you think about things like that? So you should have basically your answer is not important. There is no correct or wrong for that. It is your personal opinion. But do I know what GST is all about? Do I know what, for example, the new schemes which have been introduced by the government? Do I have some kind of an idea about it? I think that you should be clear. Okay. The next thing is personal. Now, this is again very important. For example, you come from a particular state. For example, let us say you're from Himachal Pradesh. Okay. So then they might ask you, what do you feel? Do you feel that the tourism in Himachal should be brought down? What is your opinion about it? You just take some time, just think about it, and then start answering. Whatever comes to your mind first is usually correct. right? So deep down, you might feel, I feel tourism should be curtailed or should be brought down. And then you can tell, yes, that it is disturbing the gentle balance, eco balance is gone, the green balance is gone. There's a lot of pollution there. There's a lot of, waste is there. Solid disposal is not being taken care of properly. So things like that, whatever you feel is the answer. Suppose you're from Bihar, they would ask you, what do you feel about the Bihar Jharkhand split or Andhra Telangana split that has happened? Or they might ask you about your CM, about your particular state, who's the CM, who's the Home Minister, what is happening. Anything that has happened in your state, you should be very, 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 very clear. Current affairs, especially about political, a little bit, your knowledge should be good, right? And put it out in a very nice and a very gentle way. Again, when I say personal, especially your hometown, if there is something very particular, for example, you're from Agra, there's no doubt you should know everything about Taj Mahal. If you're from Bangalore, everything about Bangalore, like probably about Vidhan Sauda or anything that is there, some big landmark that is there, you should know, right? How the city was built up. This basic brief history about your place of origin, I think, is very, very important. Okay, so that's personal. And then they can ask you about the army. Like, what is it that you have understood about the army? They can ask you the different ranking that is available in the army. They can ask you about the different facilities. They can ask you, what do you think you will be working as? So all these things. And comes the most important question. Why do you want to join the army? Yeah, you cannot tell money or you cannot tell salary, right? I mean, you can, that's always a part of it. But of course, that's the reason why I again go back to the first question, what I told you all. The most important thing for an army is are you really passionate about it? And if you're passionate, what are you passionate about? Do you like the discipline in the army? Do you like the orderly life that they have there? Do you like the structured discipline that goes on and the love for the country? All these things are very important. Don't make your answers very poetic because everybody knows that you have made it up. But if you can put in one or two of your genuine feelings into the answer, I think it really goes a long way rather than just telling a mugged up answer. You should be on the spot, and you can practice it obviously, but don't make it look like mugged up. I think it falls flat. Okay, so that's about the army. And then a very important thing which we have seen in a few years is they check your leadership skills. Leadership skills. Now, what exactly are they? Now, when you say leadership skills, you know how it is. This is how they do it. Like, for example, they ask you questions like, you're conducting a camp. Okay, or you have to do an anti-tobacco campaign in your college. How do you go about doing it? Or you are supposed to conduct a camp in a particular village, a screening and a treatment camp for around 500 patients. How do you go about doing it? So you should take some time and immediately start answering about, that you will take the required permission. You should make sure that you're taking the instruments there, so the sterilization part of it, the disinfection part of it, probably the food that is required for my staff. How many staff should I recruit? How will I handle the cases? What kind of cases should I treat there? What kind of cases should be referred back? So it's a whole lot of questionnaire which you should be ready, checklist you should keep ready before you can really go for the camp. So what they're checking is your leadership skills there. You're conducting a camp, or you're conducting an anti-tobacco campaign, or you want to give information to the people. How do you go about doing it? These are things which they've always asked. So I think your concepts there should be quite very clear. Is it okay, all of you? So medical, dental, general information, current affairs, COVID, please blast everything about COVID. Sterilization, disinfection, what's needed to be done. Personal, I think I've told you about the army, a little bit on army, air force, navy. You can know a little bit about it. The chief of defense staff, who's the recent chief of defense staff, who's been appointed. Leadership skills, again, how you answer it nicely, politely. Try to get in a lot of things into your answer. And if you don't know the answer, be very polite and tell them that, sorry sir, I'm not sure about the answer. So then they will go ahead with the next question. So don't worry. Okay. When it comes to dental, many questions students have been WhatsApping again and again. So what exactly, your your all your clinicals, I think is very important. Most of you all might have just studied for the NEET. So I think just a brief idea about the synopsis and probably your series lecture notes and your institute papers if you have, I think you can go through it and I think you should be all right. Right? Questions will be subjective and sometimes they're even very objective. Sometimes they can ask you straightforward questions like, where do you find the staghorn appearance, or where do you find this appearance? There have been questions like that too, right? Or questions will be very subjective. They can ask you, describe the different types of amyloblastoma. Like today they were asking, describe the X-ray appearance of an amyloblastoma. So whether it is multilocular, unilocular, how it looks like. These are general questions. Also, it depends on who is there in the panel, but irrespective, make sure that your clinical subjects are well read. Okay, especially to do with conservative oral surgery, and then again I think it is got to do with ortho. I think pedo and all those subjects you can manage, so it should not be a problem. Okay, so wishing you all the very best. This is a brief, a small this one. A small few tips which is required for you. Again, how you dress and all that is much more important. Okay, and how you answer them with grace, with elegancy, and with poise. And I'm sure that you'll go a long way, right? So again, if you all do get selected, so congratulations, and wishing you all the very best for the future army captains, and thank you for serving the country so well. Jai Hind. Thank you so much. Bye bye.